Welcome to the Our Forever Smiles podcast, a podcast created to support mothers of children who were born with clefts and those who love them. I'm your host, Laura Arroyo. Hello, and welcome back to the Our Forever Smiles podcast with Laura Arroyo. Again, this is coming from our latest American Cleft Palate Association annual meeting series. So we had the wonderful opportunity of speaking with different doctors, specialists, and we are so thrilled to continue this series. We have a few more episodes to go. So I want these gentlemen to be able to introduce themselves. Today we have...
You're first. Patrick Christopher. I am a cleft and craniofacial surgeon out of Kansas City, Missouri.
And I'm Robert Weiss, also cleft and craniofacial surgery out of Kansas City, and this guy's partner.
So it's been so wonderful to watch you all online. That's how I found you all originally. So what made you want to start documenting and growing your practice online?
Yeah, I can take this. I think when I first started working, like with the cleft repairs, the cleft lip and palate stuff that we do, the big thing about it is like it's a really emotional thing. And as we were initially starting, we started a practice from the ground up. So we had no visibility either online or in the public. So in talking to a lot of people about like how do we get our names out there, it just came as you can just put something up online and people can actually see what you're doing, people can relate to you, people can know who you are. And so when I think from what you've seen on what we put online, a lot of it is like it's just our daily lives, and then it's also a lot of our patients, because we do really think like our patients are who tell our story and what we're doing with our practice, and we're doing it for them. So it was really easy to be able to just like, hey, let's start like getting stuff out there. And families are so comfortable with us being like, let's celebrate your little one. And so it worked out really well.
For me, I've always not been great at social media. And this guy's always done it and been great. And he's, if you know us, you'll know pretty quickly that he's the extroverted one out of us. And I'm more private, and and I've always been that way. And I've always been really cognizant to not share and exploit patients. And I was always, under the assumption that if I'm going to share, that I either look like I'm being boastful or that I'm exploiting a patient at the sake of me patting myself on the back. I never wanted to come across that way until I really I saw what Patrick was doing and had so many family and friends reach out to me and be like, you guys need to do more. We love seeing this stuff. This is amazing. And then to be embraced by not only our friends and family, but the parents and the families of the kids that say, oh, I just love that you're using our story to really reach out to others, and can see it kind of almost exponentially impact the lives of others. It's been pretty fun.
So yeah, I experienced a little bit of that as well. As I've shared on the podcast, so my daughter Giselle was born with an isolated cleft palate, and so she, was kind of on the easier side of having repairs and all of that stuff. And so, I've always been thoughtful about how do I share her story, and like how much of that story is hers and my own. And so I did in the beginning think to myself like, what am I doing? And I want to be really like cautious of like even the stories of the other mothers that I share or that are on this platform. I always want to be really, really careful about the way that I do that, because I don't want to feel like I'm exploiting other people or their stories. And so I've thought about that quite a bit. But what always kind of like makes me feel like I'm in my purpose, so to speak, is so many people reach out to me and they say, Laura, this was so helpful. Like I was able to listen to this at night when I was getting, my baby down to sleep. I would listen to it on car rides at home, like to work. And so like all of that stuff is really helpful to know that I'm kind of doing the right thing. And it's just kind of reassuring that I'm able to have this platform to share with other families. But that's definitely something that I really, really thought about and still think about as I have this podcast.
It's certainly a balancing act, but I think I've been reassured by so many people that the the effect and the power that you can have by sharing someone's story, whether it's impacting the lives of our kiddos here in the States or abroad, it's that's the real reason we're doing it. And so when you keep that in mind, then you'll know that you won't be exploiting anyone in doing so.
Hi, I am so sorry to interrupt the show, but I just want to tell you about today's sponsor. Today's show sponsor is Sienna Dawn Media Integrated Marketing Agency. Sienna Dawn Media is more than just a marketing agency, they are your partners in progress. Their mission is simple to alleviate marketing bandwidth, allowing creative business owners to focus on what they set out to do create. Sienna Dawn Media empowers creatives to thrive without the burden of managing their own social media and marketing campaigns. Visit siennadawnmedia.com.
So why Cleft Care? I guess you could have been any kind of doctor, any kind of surgeon. Why did you choose to work in cleft and craniofacial care?
I mean, for me, it just kind of goes back to kind of like where I was born, where I was raised. So I was actually born and raised in Africa, and I've always done mission trips and gone back home. And in Africa, being born with a cleft is a pretty big stigma. And so, as throughout my years doing the missions, we'd run across kids that have clefts, and and I've always loved kids. Like kids are always like I have a lot of brothers and sisters. I have a lot of nieces and nephews. They're just like I have such a good time with them. And actually, starting out, I almost went into pediatric dentistry, and but I was always drawn to surgery. And as I progressed through my training, I think I started looking at into the cleft programs after I started residency, and it just sort of fit with kind of like my lifestyle, fit with who I am, and just also initially when I started training as a cleft surgeon, I actually only wanted to go back home to Africa to do this. And we actually still incorporate that into our practice. We go to Africa a couple times a year still. But we were just fortunate enough to be able to do it here in the US. And it's probably been the best thing about my practice as far as like treating all of our cleft kids, because you can really see the impact that you give someone from baby essentially before they're even born, and then you get to meet them, you get to grow with them, you get to hang out with the parents. The families are a big part of what we do. We're friends with them. I think it's in medicine there's a stigma of like how do you separate friendship from being their providers. I think we do a really good job of just having a boundary there, but also letting them know that, hey, we're also human. We love your kids. We want to watch them grow. We want the best for them. And I think that has really solidified, like, I love what I do now at this point. So it's been great. We love it.
Yeah, for me, why cleft and craniofacial, I was initially drawn to the field because of, to be completely transparent, I loved the intricacy and the complexity of very detailed surgery that you could see real results and affect the lives of people. But what was interesting to me when I kind of look back on my training is a lot of what I was really drawn to the pediatric population for, what as I continued to evolve through training, was really because I had realized that, like in dentistry or in medicine, where you have, or in primary care, you have repeated relationships with patients. You see them every 6 months. You get to form these emotional bonds, albeit a patient-provider relationship, and you really lose that in a lot of surgical fields because it's a lot of one-and-done type surgeries. And so what I loved about pediatrics and cleft care was that it's a bond, like Dr. Christopher was saying, it's a lifelong relationship that you'll form from birth and watch these kids grow, and we'll have our whole career where we'll see hopefully 30-year-olds at the end of this, and
Yeah.
and so that's pretty powerful, and really one of the things that I think we both continually go back to as what drives us to do this.
Yeah.
We both have different favorite surgeries. I can answer his, and he can probably answer mine. Yeah, so his is
His is a cleft palate.
his is a cleft lip.
There you go.
Yeah.
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 So this is a first. So I've interviewed a few cleft surgeons and they all say cleft lip. So I'm very curious about palate.
Well, interestingly, I told you kind of about my personality being a little bit more introverted, right? And so to me, I never want to seem, very much in the spotlight. I don't even like doing this interview, right? But what I think is often missed in doing cleft care is so many people go right to the lip, right? Because that's what's visible. That's what the population knows. But they forget about the cleft palate or the bone graft or potential jaw surgery or rhinoplasty. There's so many more aspects of cleft care that I don't get me wrong, I love doing cleft lips, but I think there's a lot of really big nuances to some of the more later stage surgeries that I think are really a fun challenge.
Which is easier?
That's a difficult question.
That's a difficult question. I mean, I think yeah, it depends on the anatomy. It depends on the severity of the difference, right? Like if you have a very wide, severe, like a wide cleft lip or a bilateral cleft lip, that's a little bit harder than a microform cleft lip or something that's a little bit less severe. But I would say I think that I treat every patient basically as an individual. So like for me to say like it's easier to do a cleft lip versus a cleft palate, it's kind of hard. But if I were to say which one's easier for me, I would say a cleft lip is probably easier. But that's just because I'm just a little bit more like I do a technique that's analytical, and so like I know exactly what I'm doing every step of the way, that I can try to reproduce the same result every single time.
I almost think that a more appropriate way to ask the question is, what's more forgiving? Because I think a cleft lip is a little bit more forgiving. Like you can get that together.
Yeah.
Now, I think there's more
always
intricacies
revise
as
it,
to
right?
how you do the surgery, the little pearls and nuances and things that you're continually improving if you're a good surgeon or wanting to. But I think there's a little less room for error or forgiveness in some of the later stage surgeries, like alveolar bone graft. Doing the timing of an alveolar bone graft can really make or break the success of that surgery. Technique for that, I think, also goes hand in hand to the success of that bone graft. Same with a palate, the length of the palate, and are you creating or being more likely to create a VPI later in life by how you reapproximated the palatal tissue? Those are a little less forgiving than, say, something that where you're going to drape a lip together pretty easily, regardless of the severity of the defect.
So that's really insightful because it kind of leads me to the next question that I have, which is how do you personally reconcile um, the pressure of having function versus aesthetics?
That's kind of hard. So I come from at least from our background of our training, right? We're always taught function, right? Like when I think about everything I do for our patients, I'm like, okay, how is it going to function? So with cleft lip and palate repair, like the cleft lip, a lot of it is aesthetic, right? But that's just not, it doesn't have a lot, there's a little bit of function to do with it, but if you do a cleft lip repair right, you're essentially addressing the function and the aesthetic of it. But with a cleft palate, it's mostly functional, right? Like it's not, no one's seen what your cleft palate looks like. So you really have to think about, all right, well, once I repair this cleft palate, what's their function with their speech going to to be like, right? And so you have to follow that longer. So it's hard to look at the cleft lip and the cleft palate and compare the two. It's hard to compare those apples to apples. I think it's more of like an apples to oranges comparison in that sense of a function versus aesthetic situation.
I think interestingly though, what's more interesting about that question is I think how you portray it to a parent.
Yeah.
Because I think so much of the emphasis right after birth is 100% aesthetic, right? Especially obviously for lip involvement. Getting parents to understand that there's feeding involved, there's speech involved,
Yeah.
there's psych, stigmas, everything else that can be accompanied to a cleft lip and palate is sometimes hard to portray to families as to why we're doing the things we're doing, when we're timing palate surgeries, and why we do it that way, and what the literature suggests, and things like that.
Yeah, I think about this a lot as well because obviously Giselle was cleft palate affected, and so she didn't have a visible difference, and so her, cleft is purely function, right? Like I had to think about how was she gonna eat, how is she gonna speak, like those sort of things came like, that was the only thing that was really at play, and I do sometimes think about, like, would I have rather had her have a cleft lip or, palate or and that question also comes from just me not knowing until she was born. Had she had a cleft lip, then I would have seen it in the ultrasound. But that is, like, one thing that I also ask parents about as well because I think that sometimes, they're afraid to share or they are afraid to share that they had this thought that they were concerned about the way that their baby would look. And so that's something that I, kind of share for them. It's like it's completely natural and normal to be worried about the way that your baby will look and the way that they will um be seen in the world. I think that's a total natural and normal way to think and feel.
Mm-hmm.
Yeah, that is 100% normal reaction. I was listening to a lecture today from a cleft patient who is also a psychologist, and I think it's important to realize that as the surgeons, we haven't lived that experience, so it's really hard for us to put ourselves in those shoes as much as we try to, and so like sometimes we just have to ask outright or just say it outright and see what the response is. But I think, yeah, the cosmetic part of it's a big deal. I
For
mean,
sure.
and and that actually kind of looks at like in Africa, right? Like it's a big stigma to have a cleft lip. In fact, like they'll hide their kids if they have a cleft lip.
Mm-hmm.
And so when we go to Zanzibar, we see a lot of kids with cleft lips that are a lot older than they would be here. Just because here it's diagnosed prenatally, they know it's coming, but there they're born with it, and then they have to sit and think about it over time. And it looks bad on the family. It makes them think like, well, we did something wrong, and that's why our kid has a cleft lip. And so the aesthetics of it plays a big role into
Mm-hmm.
it. But yeah, I think it's got to be a conversation that we probably should have a little bit more. I feel like.
I think during one of the lectures I was in today, Dr. Paul Klustra said it so beautifully that I wish I could almost like record it. He was talking about how the initial stigmas and emotional response of a parent that is almost mourning a child being born with a cleft lip, and the social implications and what that'll look like, and the guilt, and so on and so forth. And he balanced it and quickly counteracted the statement with the amount of basically disappointment and just the emotional feeling of loss as to when the cleft gets repaired that they will inevitably feel because that's their baby, that's what they learn to love, and that's they lose a little part of that when it gets repaired. And that's, I think, a challenge that some parents have no idea that they're going to have almost an equal but opposite emotional response to it being repaired as to having a child born with that facial difference as well.
First of all, I appreciate that you called us young. No, it's.
I
Oh
do
my
too.
God.
We are young. Don't worry.
You don't wake up with
Don't let
back
him
pain
fool
every
you.
day, or like knee pain, and like your thumb hurts. That's like a thing.
Nobody
40's
that's
bad.
old talks about 30 years left of practice.
Yeah, like 10 years left.
As young surgeons, what have you seen to be like the latest advancements in cleft care?
Well, I mean, I'll say this. I think that we have kind of a distinct or a different pathway to training with being both oral maxillofacial surgeons and cleft surgeons, right? Like we get to see advances from both fields. And coming to ACPA, I think the thing that I really enjoy is all the research that's being put out on just specifically cleft lip repair, right? Or specifically cleft palate repair. The really, really cool thing for us now that we're able to do is like when they get older to get to their orthognathic surgery and their jaw surgeries, there's a ton of advancements with technology that make it very not easy to do, but makes it a very predictable surgery now that I think in the past, the outcomes aren't, in my opinion, aren't as good as they are now. And I think that's like probably one of the biggest things that we really appreciate is just like the technological advances and being like virtual surgical planning. Even with like younger on when you're doing bone grafting, you can print their splints now, right, to help stabilize their alveolar segments. You can take CT scans to actually visualize the cleft before you get to repairing the alveolar cleft. So I think my big takeaway with it is the technological advancements
Yeah.
that has really made it easier.
Yeah, I
I
think
would,
so too. I think the technological advances continue to expand the field. I think and to answer your question maybe a little bit differently, because he really talked about like the surgical side of things. One of the things, and again, we're both young into the field, but I think one of the things, especially as we talk to some of our predecessors and previous generations, that I think is just so fascinating, but also really welcoming is the amount of collaboration that I think has now increasingly kind of come to the forefront of the field and ACPA. We have, open meetings where we're discussing things across, specialties
yeah.
with, varying surgical specialists or speech language pathologists, team coordinators. There's a lot of collaboration. There's a lot of teamwork. There's, oh, well, how do you guys do this? And I wasn't there a generation ago, but I know that from people that I've spoken with that, it hasn't always been that way. And I think that open dialogue continues to make us a much greater team altogether than staying in your own little bubble and putting your elbows out and that kind of thing. So it's certainly something we embody and always have, but it's really nice to see that well reciprocated in this environment as well.
So, of course, there are two of you. So, how do patients choose between which surgeon they would like to have surgery with?
Yeah. Our club team coordinator's here. She can attest that's not the case. No, so how we do it at our clinic space, how we do it is we are constantly enforcing a team-based approach. And so while he may be the primary surgeon overseeing the care of one kiddo, or I may be the primary surgeon of another, how I always tell my parents and my patients are that, this is a team-centered thing. You're the star. We're here to help you get there. And if it's my case, you get 4 trained hands one way or another. And so he's in every case that I do. I'm in every case that he does. It's 4 trained hands instead of 2. We sit in there and we do a much more efficient and good job having more, 2 sets of eyes and all that kind of stuff. So
Yeah.
that's how we approach it, but not every team is that way. I think that just kind of works for us. We're also in the same practice, in the private practice side of things too. And so we're stuck. We're stuck with each other one way or another.
Cat dog stuck.
So, how do you provide patients with a timeline of what to expect without overwhelming them?
So we do a really good job with our institution of doing of these things getting caught early on. So we try to really reinforce it multiple times over a period of visits. We'll see a lot of our patients prenatally. And so we'll talk to them, especially if it's caught prenatally, right? And we'll have a conversation about, hey, you're going to have a ton of information. It's like drinking out of a fire hose, right? Like you go in this visit and you have the SLP talking to you, you have the surgeon talking to you, you have the coordinator talking to you. And I think the thing that we really, really try to emphasize is that, hey, this is a lot of information. We're going to give it to you multiple times over like 3 or 4 different visits. So as far as like surgical timelines go, they may hear it from me on that first visit. And I always tell families, hey, when you go home, take your phone out. Everyone's on their phone anyways. Write your questions down, right? Like, I feel like being in a room with him and I during a consultation or just sitting in a room talking to a group of people can be really intimidating. So it's really always important to, when you go in the parking lot, if a question pops up, just write it down, and you can either text us or call us and come back and we'll give it back to you. And we do a lot of handouts with surgical timelines so that they can go home, read that information, digest it. And ACPA has a really, really good set of handouts that you can give patients that really enforces that, hey, if you have a cleft lip and palate, this is your timeline in that first year. This is what you are to expect. And we heavily utilize that a lot of the times. And I would say that our coordinator is great. She can answer every single question the patient calls about. And so we try to have just different points of contact for the patient that really reinforces the same thing over and over and over. That way they don't feel so like overwhelmed by it.
I think it's important to acknowledge that it often is overwhelming, regardless of how much information you're giving them. I always tell them there's not going to be a test at the end of this. You're going to be given this in a written form. You're going to be given this so many times with us standing in front of you, and you're still going to have questions that you're going to think are silly, questions that are relevant, questions that are relevant for 5 years from now. And so we do a good job of explaining things, but also taking that pressure off them and letting them know. We give every one of our families our personal numbers. And so they text us any given day, whether it's, hey, so-and-so's birthday is next week, or what do I eat after this surgery again? Or, what can the kid eat? What can I eat? Whatever it is. And so we're always available. And I think that gives them a lot of peace of mind to feel like, okay, I may not know all the answers right now, but anything that's really pressing, I can find out, really quickly.
What is your timeline?
For our typical repairs, I think pretty standard. I mean, we usually indicate that they'll have a lip repair done 4 to 6 months, palate repair done around a year. Alveolar bone graft is really predicated based on where the developing teeth are and the cleft site. They typically start looking at things around 5 to 6, but the bone graft can vary from anywhere from 6 to 10 years old. And then we monitor for growth to see where the jaws will align. We really do a good job of having early conversations about skeletal growth and let them know that there may be a jaw surgery that could really benefit as one of the final procedures.
So I was going to ask you a controversial question.
You might get a controversial answer if you ask us a controversial question.
We love controversial questions.
Yeah.
It's not that controversial, but what are your thoughts on early lip repair?
For which surgery?
For like a cleft lip. So, I mean, there are institutions that do the early repair. So I think you can do it. I don't think that it's a you shouldn't do it type of thing. I think in our setting, we love to be able to get the kid healthy enough, getting the good weight gain to get to the point that they're actually able to get the surgery at around that 4 months. I've done repairs at 3 months, right? There's some times where it can call for that. If you have a child who's just exploding with weight, you can do it a little bit earlier.
Well, it begs the question: Are you
cosmetic.
asking our opinion of an adhesion, or are you asking
No, just like a
early
cleft lip
repair?
repair,
And if early, what defines early?
I think
2 months.
Under 3 months?
Doing it a little bit early. So UCLA will do
Under
it
3?
earlier, 3 probably. I think you can do it, but I think just for our institution and how we have it set up, I appreciate being able to do the repairs when the kid is a little bit older. There's a little bit more tissue, and then also just as far as like anesthetic complications and just being a little bit more safe for anesthesia, you could do it a little bit earlier, right? We treat kids in the NICU all the time, where we'll do kids at 2 weeks old and do their surgeries then. But I also always have to remember that a cleft lip is truly cosmetic. It's not going to really affect their function of how they're eating. It's not going to really affect how they're growing, as long as they come in and see us and we sit with our coordinators, our SLPs, and actually teach them. But I don't think it's that controversial. I think it's
No.
all center dependent, honestly.
Yeah, and I think it's an interesting question more from like the philosophy of like how we talk about surgery. Everybody has an opinion,
Yeah.
and a lot of people will have very strong opinions about the way they do it, and how they do it, when they do it, why they do it, and how they do it. And I've always tried to really adapt the mentality of some of my mentors of being like, well, my way doesn't mean it's the right way,
Yeah.
but if it's the right way for me and if it's a way that I can do it with a repeatable good result and one that I can decrease complications and have repeatable good results for my patients, then there's no reason why my way is different or better than someone else's that can have good results in a different manner. So I think early, late, it's not. It's a nuance.
Oh, is it
Mhm.
really? Oh, yeah.
Yeah, no, I get that. It's super controversial in the parenting groups, and people are just like, "How could you ever do that to your child? It's too early." So,
Yeah. Well, yeah. Well,
Well,
I mean, I think it just goes back to like what you hear from your surgeons, right? Like when we talk to our parents, we give them the information of like, I think it's a little bit better to do it a little older, and parents trust us. And if you go to someone else that does it earlier, they have their reasoning of how they do it. And I think it will definitely drum up some controversy and
there's a
like,
little bit of parroting, right? And so, it's a passionate topic, right?
yeah.
And so anytime you have a very passionate topic, something, especially when a kid's involved, parents are, they're mama bear. And
Yeah.
so they're going to advocate for their kid however they can. If that means going on to a Facebook forum or something like that and really stating why they think that's the best reason, then that's great. But you have to be a little careful with how you interpret those
Yeah.
because you know what they say about opinions.
I would say listen to your surgeon.
want to make sure that I give you all the opportunity to talk about your foundation and the work that you all are doing. So, first, what is the name of the foundation and what have you all been up to recently?
Want to
We
start?
can, you can start. I'll start. Our foundation is called Forever Smiles Foundation. And when we had come to Kansas City, we had a lot of kids on the team that just weren't, that financially it was hard for them to get some of the care they needed. And the big thing though for us is that we'll treat anybody, and as if they have money or they don't have money, if they don't have the finances for it. And when it comes to the hospitals, they don't think like that. And so with our cleft kids, just in the U.S. and in Africa, we realized we have a lot of friends that can really help them out. So our foundation was basically we wanted to really gather the support that we have around us to say, hey, this is a cause that we both believe in. This is a cause that we both really, really want to actually advance. And so we started Forever Smiles Foundation in 2000 and what was that?
23.
23 last year in July of
Got
23.
approved last year.
And it's basically we have three arms to it, and I'll just kind of talk about one of the arms where we're really supporting our kids in the U.S. And we really want to support the kids on our team, but also the kids that are born with clefts in Kansas City, whether they come to our team or they don't come to our team. We want to be able to be there for them, not only financially, but also just to be there to support them through their care if they have questions. And so we've built a pretty good team to do that. And Rob can kind of talk about the
Yeah,
other
and then
part
the
of it.
kind of the other arms and just to piggyback on what Dr. Christopher was saying, I think the reason we kind of started this nonprofit organization is just to kind of use our platform as to really affect as many people that we can and touch as many lives as we can. And so some of that, like he alluded to, is in Kansas City where we have our primary practice. But also we go to Africa several times a year and are in efforts to, well, we've partnered with an organization there and we'll have recurring trips to the same hospital, the same area, with intentions to set up a clinic space there as well. And when we go there, we're actually training the surgeons there so that there's continuity of care, routine follow-ups. These kids aren't, lost to follow-up or forgotten about. They see the same surgeons every time. We come back at least every 6 months so that they're seeing someone at least a couple times a year throughout their early years and into adulthood. And then our last arm is an educational arm for the nonprofit, so that and eventually in the near future we'll hopefully start training the next generation of surgeons to go out and everything that we've done we've kind of seen as like a way to exponentially impact others. And so if we can train other surgeons to go out and affect that many kids and help that many kids and parents, then we're even more helpful to the community.
Yeah. Yeah, we love it. It's I think it's probably been the best part of what we've done with our Cleft team is starting the foundation. I mean, it's amazing the support that we've gotten from our community. I mean, I think it's just
Yeah, for sure.
it's going to be probably one of the best
And
years
it's
we've had
also
this year.
pretty eye-opening as to, you think, in the US, there shouldn't be any obstacles to care, medical care or paying for things,
Yeah.
insurance, you qualify, okay, here it is. But there's a lot of things that you don't think about. Access to care, formula, specialty bottle feeders, transportation, hospital fees that may or may not be covered, braces later in life, almost never covered, right? And so there's a lot of really challenging things that I think having a revenue source that we can pull together to help say, hey, we can do this. This is an option for you, for parents that couldn't otherwise afford it, is really, really beneficial to our kids.
So, if you could rewrite any part of the experience for families, whether it is how it is delivered, explained, or supported, what would it be?
Uh,
I think the hardest thing that we continually try to work on is, and I think sometimes we're better at it than others, is really relieving parents of that guilt. The parental guilt is a huge burden, and it's really heavy. And I think, as a father who has kids that are not affected by any facial differences, I think, I can certainly empathize, but can't sympathize with how, stressful that would be for a parent, and to feel like, oh, well, what caused this? What was that problem? And so I think if there's like any kind of area where I wish we could have more development and be able to pour in more resources, it's to things like you're doing, where we can really support families and parents that just need a network and community. I think we're getting a lot better at it, but I think that that's something that we continue to see parents that have, they just really feel down and don't feel like they have anyone to turn to. It's one of the things that I think we love about our team the most, is that we do so many group organized activities where it's a very tight-knit group that they are friends with each other and they can ask each other, hey, what should I expect? Or how did you deal with this? Or did you battle with this? It's super, super underrated and really powerful.
yeah. I mean, I would definitely agree with all that Dr. Weiss just said. And I mean, I think for me more so it's that, and I alluded to this earlier, I think just that being able to allow parents to have a little bit of autonomy and then just creating that relationship with providers, families, and parents. I think that, a lot of places we just need to, and not a lot of places, just medicine in general. I think it's come to a point where it's like you're treating patients, but you're not forming that relationship with them, and it's become almost depersonalized a little bit. And I truly believe in just having that experience of, hey, I'm heard. I feel like someone's actually listening to what I need, what I want. And it may not be what my child needs, and at least they're listening to my family and taking all that into consideration. I
Yeah.
think we're trying to really,
And I think what's interesting
build on
about that is when you combine that with Dr. Google and a lot
Yeah.
of parent skepticism and
Yeah.
everything else, it's hard to form harder to form those relationships that were previously built on this, blissful trust that
Yeah.
you didn't have everything at your fingertips to go and double check or go and get a second opinion, or I didn't feel right about that, or that's not what this Google forum said, or whatever it may be.
Facebook forum,
And
buddy.
yeah, right. And so it's
Gotta get there.
it makes it challenging
Yeah.
to form that level of trust a lot of the time. You're welcome. Thanks for having us.
Yeah,
Appreciate
thanks for
you.
having us. Seriously.
Hey everyone, it's Laura here. I'm popping in today because I need your help. If Our Forever Smiles has ever helped you, if you've learned something new, felt less alone, or found hope through this podcast, then I'm asking you to help keep it going. Creating this podcast, sharing stories, and building a space where Cleft families feel seen and supported is something that I pour my heart into. But the truth is, I cannot do it alone. If we want to reach more families and provide even more resources, we need your support. So I thought of a creative way to do this. For just $2 a month, you can help ensure this podcast keeps going strong. For $5 a month, you'll unlock exclusive Moms in Real Life content, real unfiltered conversations about motherhood and career and everything in between. And then for $10 a month, you can get everything plus exclusive merch to show your support. If this podcast has helped you and you want to see it grow to help other families that are probably facing the very same challenges that you are facing right now, please consider supporting us today. Every dollar goes toward making a difference for Cleft families just like yours. And right now, we'll be using the funds to elevate the show for production. So we'll be able to add more video and just get new equipment. And as soon as this community is established and we're able to do more, we definitely plan to go beyond the scope of just this community. We want to be able to support scholarships for new craniofacial surgeons. We want to be able to support global surgeries and just really spread our efforts to continue to make an impact in our community. I just want to thank you in advance, and I'm just so grateful that you all are able to support me and support this community here. And it's definitely something that I'm really looking forward to. The link is in the show notes, and I just want to do a shameless plug here. The Moms in Real Life podcast is so cool, so candid, and yeah, it's definitely something that you'll want to check out. Thank you all again.